everyone, I'm Dr. Michelle at Valley Vet, and this here is my buddy Daisy. And today we're going to talk to you about Dental Month. February is National Dental Month for us in the veterinary community, and what I'd like to go over with you guys today is basically what we do when we have a pet in here for a dental. So as you guys come in for your annual exams with your critters, what we're going to do is examine the teeth and grade them based on a 1 to 4 scale as far as how their dental mouth is progressing, I would say. And I have a chart here. It kind of gets a little grody, but this will show you the different stages of dental disease. This is a grade 1. Down here is a grade 2. And then when we flip over, it gets worse. This is grade 3, and this is grade 4 periodontal disease. And as much as I like to say we see a lot of grade 1s and we clean teeth, usually we're looking more towards this side when we start having pets in for dental care. So we're hoping to change that, get pets in earlier, have less teeth that need to be pulled, and have better overall oral health. So when your pet does come in for a dental, the first thing that happens is they get greeted by one of our lovely kennel staff. They get set up with a nice little comfy kennel, and when it's time for their dental procedure, we start first with doing a pretty thorough oral and physical exam on them. And there we're kind of grading the dental disease, figuring out what type of anesthetic meds would be appropriate for your pet, and basically doing any pre-anesthetic blood panel screenings that we need to do before we go in and do any type of anesthesia. In regards to anesthesia, we use what's called a multimodal approach, and what that means is we use small amounts of multiple medications that work synergistically together to basically provide a good plane of anesthesia that's very, very safe. So what we'll do first is what's called a pre-medication. This is an injection of a medication that goes under the skin, and it basically provides light sedation as well as some, we get our pain medications on board before we start doing any work with the animal. Once they're feeling a little more comfy, we do have them come out and we do what's called induction, and that's where we give medication that goes intravenously into the bloodstream, and it basically places them under, gets them prepped for general anesthesia. At that point, we do some very important things. We start with placing an endotracheal tube, and what that does is it allows us to provide them with oxygen and gas anesthesia at the same time, as well as protecting their airway. I'm sure many of you guys have been to the dentist, and you know when they're doing the scaler on you, there's water everywhere, and our pets, unfortunately, we can't tell them to spit or suction it up, and so we want to make sure that the airway to the lungs are closed and secure so that we don't have any risk of aspiration pneumonia. Once they're fully under and on gas anesthesia, we have multiple monitoring systems for them. And so we have heart rates measured, we have our pulse oximetry, which is going to measure your oxygen concentration. We also have blood pressure monitoring during this time. So we have multiple systems that can tell us if anything seems off or if we need to stop the procedure and reverse the anesthesia. From there, we start the dental cleaning, and it's a majority of the time it's a 2-step process. We first start with scaling the teeth. That's with an ultrasonic scaler. You may have had that done on yourself before. And the nice thing about that is it pulls tartar off, not only from what you can see on the tooth area, but also up underneath the gingiva where we can get some pockets, have some tooth root issues, and it really does a thorough cleaning on there. Once the scaling is done, the doctor comes over and will assess each tooth and see if there's an issue involved with any of those teeth. And then from there, if everything looks great, we finish with polishing the teeth. It's a very important step because the scaler does cause some ridges and some roughening of the tooth enamel there. And what we want to do is smooth that out to help prevent tartar in that area. Once that is done, the patient is turned off anesthesia, and we go ahead and have them prepped for monitoring post-surgery until they are well awake and back in their kennels waiting for you guys to come pick them up. So that's our general dental procedure. We do have a lot of other things that happen. We have a lot of teeth that need to be extracted. We also are just now getting our dental x-ray unit set up, so we're really excited about that. So we have a lot coming this next year with dental care. We have a lot of really cool new at-home care, dental care. You may have seen that video with Dr. Kaylee talking about our dental wipes, because we really like to see less grade 3, 4 periodontal disease and more grade 1. So I hope this helps clarify some things for any pet of yours that may have to have a dental. We really pride ourselves with our dental care here. We have a really great system. It works very well. If you have any other questions, feel free to give us a call. If you want to get your pet scheduled for a dental, we do it Monday through Friday. So hopefully we'll see you around and see you at the clinic.